Unintentional injuries are the leading cause of death in children. Safe Kids is the name of a program that was created to help prevent injuries and spread awareness. Safe Kids coordinator Carma Hanson is here to talk about how she is helping prevent unintentional injuries. Thanks so much for coming on the show today.
Thank you.
So first off, what is the Safe Kids program?
Well, Safe Kids Grand Forks is a local coalition. It is one of about 660 coalitions across the country. And it was started by a pediatric trauma surgeon in Washington, D.C., who was seeing children coming into the emergency room with things that are oftentimes referred to as accidents, but they were certainly very preventable. And so he launched an effort that has gone across the country and actually now into 16 countries around the world. And it is aimed at preventing unintentional or accidental injuries in children.
All right, so the Safe Kids program is actually worldwide. So kind of going back, what is your role within the Safe Kids program?
Well, All True Health System is the lead agency for Safe Kids Grand Forks, and so they employ me as the coordinator. And my job is to bring people from the community and really around the region to the table to address the topic of unintentional injuries. And in doing that, we help with developing programs, finding volunteers, looking at the injury data, both injuries and deaths, to determine where we should be putting our resources. And then we come up with programs that are effective and will make a difference. And I work with coordinating the volunteers, helping to formulate that message, making sure that we have the necessary resources and things needed to carry out our injury prevention strategies.
Okay, what is the main goal of the Safe Kids program?
Well, it's pretty simple. We want to prevent unintentional injuries and deaths to children under age 14. That's the number one thing that kills them. You know, you oftentimes hear about heart disease or strokes or cancer, things like that. The number one thing that kills and injures children under age 14 is unintentional injuries. And so my goal is really to put our emergency room and our PEDS department out of business.
All right, so you kind of mentioned earlier, volunteers. Who are some of the people that work for Safe Kids?
Well, we have a lot of people that come to the table, and really it's about collaborating and not competing. And so anybody within the community or the region that has anything to do with injury prevention for children. So we'll work with like the fire department, law enforcement, people from the university, people from the YMCA, Parks and Rec, sports teams throughout the area, really physicians, nurses, anybody who has anything to do with preventing unintentional injuries or injuries in children, bringing them to the table and saying, how can we together be stronger than us working individually or in our silos?
So kind of getting a wide array of people all over the community to help out.
Absolutely. Yep.
What is the program is targeted towards, children 14 years or younger. Is there anyone else that you target with this program?
Well, we're aiming to prevent unintentional injuries in children under 14, but our message really kind of covers a broad spectrum. We do education for children, but then we also have to do education and awareness for people that take care of children, so it includes parents, caregivers, that might be a grandparent. We work with child care providers and educating them on how to make their child care settings safer. We work with schools and policies that they have. We also do a lot with engineering changes within our community and region. So we work with like city traffic engineers or people building the roads or the bike lanes or putting up signs. We educate physicians. So as patients come into their office, they become more aware of what type of injuries and preventative measures they should be taking. We'll work with the law enforcement to teach them, how to be looking for kids who might not be transported safely in motor vehicles. We work with local legislators to look at passing laws that make it a safer environment for the children within our state, or local legislators, our city council people, to make our city safer. So there's a wide variety of people from infants all the way through adults.
All right, so you kind of talk to anyone that would come in contact with a kid that could possibly have an unintentional injury.
Yep, absolutely. We all kind of have to play our part.
Right. So you talked about, this is the leading cause of death, but why is it such a prevalent issue?
Well, I think it's because children are curious. They like to explore, they learn there are dangers out there, and our goal is not to take away the fun of being a kid. We want kids to play on playgrounds, we want kids to ride bikes, but we also want them to do it safely. And I think the thing with Safe Kids is that we know, let's say there were a huge flu epidemic this year, people would be lined up to get their kids flu shots to get rid of this horrible flu that might keep them out of school or keep them from playing hockey or basketball or whatever, make sure they can go to childcare. But parents aren't necessarily always aware of what it takes to prevent these types of injuries. You know, putting a bike helmet on a child, 85% effective in reducing head injuries. Motor vehicle crashes, #1 thing that kills or injures children. And so we need to teach parents that by buying a simple booster seat or a car seat and then using it effectively, we can prevent the things that are the #1 reason why kids are dying. And so we're here to serve as a resource, and we want to help them and provide some expertise to make parenting a little bit easier.
All right, so what is the most rewarding part about what you do with Safe Kids for you? Yeah.
Well, you know, it's funny. I kind of take ownership for a lot of the kids within our region, and when we hear of a tragic car crash or somebody dying on an ATV, or I see kids coming into the ER with head injuries that could have been prevented with a bike helmet, you feel bad about the ones that you don't affect or that maybe didn't get your message. Oftentimes we don't hear of the ones that are saved because they did something right. I think what is very rewarding is when we hear of a child who might have escaped an injury or a death because of a message that they got, or parents who have changed a behavior because of something that they learned, and they go, I never realized that this could be a potential, or I changed the way I set my house up, or I put my kid in a car seat and it made a difference.
All right, thanks so much for coming on the show today to talk about such a great program.
Yeah,